Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Gordon Sansaver III, Associate Executive Director at Virginia Mason Institute, a global healthcare consulting organization transforming healthcare delivery worldwide. With over 18 years of leadership experience, Gordon has been instrumental in driving VMI's international expansion, including leading their European subsidiary launch in London under his leadership. The organization achieved 40% increase in qualified leads and 53% rise in total pipeline value. His journey from production system specialist to executive leadership offers an invaluable insights into how lean management and healthcare innovation are reshaping our industry. Welcome to Health Tech Heroes, Gordon.
Thanks for having me.
And I appreciate your time, and journey looks pretty exciting, from a system specialist and to executive leadership, and I'm sure there are a lot of learnings there, and I'd love to dig a little deeper into this. So you have been with Virginia Mason for 15 years and growing from production system specialist to associate executive director. What originally drew you to healthcare transformation? What did those early days feel like?
Yeah. So when I first started in healthcare, I was actually getting my undergrad and decided that at the time, that I was interested in going to med school. And I thought that being an EMT, emergency medical technician, and working on ambulance crews would set me up well for that. So while I was getting my undergrad, I got my EMT license. I started working on ambulance crews, and very quickly through that experience learned that perhaps direct patient care wasn't the best space for me. However, I did fall in love with healthcare as an industry and started to see, even at that very early stages, how much waste there is in the healthcare system, how much opportunity there is for improvement and change. And so I changed course and went more the business route. I got my MBA and I started working in healthcare administration. And through working in healthcare administration, I had the opportunity to join the Virginia Mason Medical Center, so process improvement team, and get certified in lean management systems. Had an opportunity to learn from Shingijutsu Consulting in Japan, and really start to think about what would it look like if we took the tools, concepts, and the approach of lean manufacturing and we applied it in a healthcare setting. Virginia Mason Medical Center is known as one of the original health systems to apply lean manufacturing principles in a healthcare setting. It's been over 20 years since they've been on their journey in that space. And I was really fortunate to be able to essentially be near the ground floor of that experience and be able to gain experience that way.
That's fantastic. So you went into Japan and worked in Toyota production system to learn about lean, because I believe Toyota was the origin of the lean system to begin with. I'm sure there were certain modifications that have to happen to bring it from Toyota's production line to healthcare.
Yeah, so as I mentioned, Shingijutsu Consulting is founded by Sensei Nakao, who was trained by Taiichi Ono, who is the founder of the Toyota production system. And so got to learn from Sensei Nakao and his team, who has spent many, many years coming and visiting and advising at Virginia Mason Medical Center. So I've got to learn from that way, but also, as you mentioned, had the opportunity to travel to Japan to learn directly from them, to tour Toyota, to work directly on the shop floor at Hitachi in Japan and look at how they're applying the concepts, and to be part of a training workshop in that space. And you are correct. When we first started that journey, we heard quite often, people aren't cars. So how could you bring these concepts that are from manufacturing to healthcare? Healthcare is all about people. Talking with physicians about changing in a way to be open to using some of the tools and concepts. You'd hear many, many times, and I've heard this many times over the years, that medicine is an art and a science. When you bring in the complexity of working with humans and you have the stress of potentially harming people if you do something wrong, you could see how somebody might be skeptical. But a relentless focus on quality and safety just seems logical from my perspective. You want to provide the highest quality experience for your patients. You want to provide zero harm to those patients. And so many of the concepts really were very applicable. And I think today, 20 years later, I think many more people can see that. I still think when you say the word lean or TPS or Toyota Production System, sometimes it has a negative connotation because so many people in the healthcare space have attempted unsuccessfully to implement some of the tools and methods. And my perspective and the perspective of Virginia Mason Institute is that's largely due to a lack of proper setup and change management and a focus on creating the culture within your health system where process improvement tools and methods can really flourish.
Essentially taking the best of lean and applying it to the healthcare and being systematic about application works really well in your experience. Right, Gordon? I got it right.
Absolutely. Yeah. And as I mentioned, that last point, I mean, the leadership role, the role of the executive in the health system, and the culture within that health system, those things have the biggest impact around whether they're going to succeed or not. Because something like the Toyota Production System thrives or doesn't exist unless you have both continuous improvement and respect for people. And if you don't have that deep respect for people, if you're not creating an environment where leaders and everybody in your team can speak up for safety, if there isn't a clear response when you identify something that's not safe, that's repeatable, and people are rewarded for calling out errors and mistakes, then it's pretty much impossible to be successful.
Thank you very much for that. Going back to your previous response, I think you said direct patient care was not something for me, and I switched and I went on the business side of things. What happened there? Any specifics?
I mean, you
don't
could
have
you
to
could
answer that question. Yeah.
yeah, you could imagine working as a first responder on an ambulance and the kind of things that you're exposed to. It's really stressful time for people. You have people that are having strokes and heart attacks or in a car accident and high stress, and some of the interacting with people perhaps at the worst time, the worst moment of their entire lives. And I felt like I did a really good job, and I felt like I was a calming presence, and that worked really well for me. But I found that being in that environment day in, day out, it didn't seem like it was the right career path for me.
Was there any particular incident that kind of precipitated that for you? You don't have to
I think it
answer
was.
it at
I
all.
think it
You
was a
know that.
combination.
Yeah.
It was a. I don't think there was a specific incident. I think combination over a couple years of, being exposed over and over and over again to similar things, and then just deciding that I wanted to go a different direction.
The direction you have taken does help at the population level, so it's a noble cause.
Yeah.
And also, you did relocate your entire family to London to lead VMI's European expansion. As a father, a husband, what motivated such a big decision? And how did it shape your perspective on global healthcare?
Sure. Yeah. Just to back up just a tiny bit. So, Virginia Mason Institute. So, we're a nonprofit education, training, and consulting business wholly owned by Virginia Mason Medical Center. So, I mentioned that I had an opportunity earlier to learn about the Toyota Production System and learn about lean manufacturing principles and how those might be applied in the medical center environment at Virginia Mason Medical Center. And there was a lot of interest and notoriety that came out of the success of those efforts. And that led to the formation of Virginia Mason Institute, where I've been for the past 15 years. And our focus is around helping health systems to create a culture of continuous improvement. And one of our biggest partnerships that we have is with the National Health Service in England. And so dating back to 2015, we started at Virginia Mason Institute, we started a 5-year partnership with 5 acute care trusts in the National Health Service. And one of the things that we needed to do very quickly is determine the best way to operationalize that. So my role at Virginia Mason Institute, I've had a variety of roles and pretty much held every role within Virginia Mason Institute over the years, but I've always had responsibility for our operations and determining how we function and what resources we need and what the business strategy that we need in order to be successful. And so we reached a crossroads where we had to determine what is the best way to support this new 5-year partnership with the National Health Service. And it became too much of a logistical challenge, too daunting to think about how we might support that with a team that is largely based on the West Coast in the United States, with the 9-hour flights to London from Seattle and that sort of thing. And so I had the opportunity, with the support of our board, to relocate and to establish our subsidiary in the UK that helped us to comply with labor laws and the different structures that you need to, and different regulatory things that you need to be aware of and be compliant with when you're operating as a US company that's supporting clients in the United Kingdom. Yeah, so that experience, it was amazing. It was an excellent experience. And, like you said, as a father, I have two daughters. At the time we relocated, they were 3 and 6 years old. So it was a fairly good time for us. They weren't too rooted in the community and school and sports, that sort of thing. And, it was an amazing opportunity to be able to bring my family into a different part of the world, to expose them to a different culture. My daughters got to go into state school, into the public school system in the United Kingdom, found a really good school in London where we are based, and built a really great group of friends and community. And it's amazing how international it was as well. London's obviously one of the biggest cities in the world, but my older daughter had her little group of friends that she formed. There was a girl from Turkey, there was a girl from San Francisco, a girl from Germany, one from the UK, and another from France. And so, the 6 of them would, and it was just like, being, learning, becoming friends with that parent group. It was an amazing experience, and it does give you an appreciation for kind of how small the world is, really, and how we all are. It doesn't matter where you are in the world, we all have similar issues we're facing, we all have similar things we're experiencing, and it really gave me an appreciation for diversity and the importance of being exposed to other people's point of view.
Yeah, wonderful. And I think the other benefits of being in London is the accent. I love the British accent and the Indian food. The food is really good there, the Indian food, especially. A lot of Indians there.
Yeah, when I first started going to the United Kingdom, before I moved there, we had clients in the northeast of England, and so I didn't spend a lot of time in London. I spent a lot of time in Newcastle,
Okay.
in that area. And I'm sure it's different now, but at the time I was going there, 15 years ago, the food wasn't great. I had a hard time finding good food, and I'd be like, oh, just get me out of here. I need better food. But being in London, man, excellent food. And I just think the food culture in the UK has really exploded and gotten so much better over the last decade.
Yeah, no, I'm hungry for that paella in Burroughs Market. I think you might know what I'm talking about.
Yeah, absolutely. Absolutely.
For listeners who are unfamiliar with VMI, can you explain what the healthcare transformation looks like in practice when you work with the health system?
Yeah, transformations, it's kind of a buzzword, right? But when we think about transformation at Virginia Mason Institute, it's really about transforming culture. It's really about building capability within the health system for the executive team and the leadership team to have the skills and the tools to be able to guide the culture change that they want to see within their health system. To create a culture where they're empowering people to improve, to be a part of improvement, and really trying to break some of those traditional leadership roles that are more command and control, more top down, where, I'm the CEO, I told you to do this, just get it done. There's a place for that, and there's a time for that. But in general, we find that if you have a culture that encourages people to engage in improvement, that gives people a say in the way that things are happening within their health system, you're going to have happier staff, you're going to have happier patients, you're going to have more quality and more safety within that health system. And so again, for us, when we talk about transformation at Virginia Mason Institute, it's about culture and it's about people.
That's so you're basically transforming the culture, which will have business implications. Can you share a testimonial that you received from a system and the leaders?
Yeah.
that you are so proud of, saying that, hey, we did this?
Yeah, I mean, so working in that 5-year partnership I mentioned earlier, one of the hospital systems in particular that we worked with through the 5-year journey and through a focused effort on building capability around process improvement, developing their leaders, and focusing on culture change, they were able to achieve an outstanding rating from the Care Quality Commission, which is a body that rates an independent body that rates the quality and safety within health systems in the United Kingdom. And so they have received the highest possible rating. And so their rating took a look at the financial component of the health system, also leadership, staff satisfaction, patient satisfaction, all those kind of big dot metrics that you look at in a health system to determine how successful it is. And one of the things that we struggle with at Virginia Mason Institute is when you talk about culture, and you talk about people and developing people, it's hard to have like a very clear straight line to return on investment. And as you know, working in the healthcare space, I mean, healthcare systems everywhere are strapped for cash and they're struggling financially to compete. And that's why you have all these mergers and acquisitions and all these different things that are happening to try and create an environment where the health systems are financially viable. And it's, again, when you're talking about culture change, you're talking about 5-year partnerships, it's hard for health systems to commit sometimes. But we do have, a belief, and the data has proven this over the past, 15 plus years, that when you focus on removing waste from your system, when you focus on developing your people, you see a financial gain. You see a financial impact. You have less turnover, which means less people that you're needing to recruit, and you're able to better address labor shortages. You have less burnout within your health system because people feel like, what their work matters and that they have a say and that they're have good relationships with their leadership team. And all these things have such a massive impact. And there's another example at Leeds Teaching Hospital in where they were able to very quickly, through having skills in process improvement and the culture that we've talked about, they were able to bring a group together and to address an issue where they were struggling financially, in an area where they're struggling financially, and they were able to save millions of pounds, identify millions of pounds of savings in a very short amount of time, and they've been able to sustain it since then. So, if you have that, if you invest in your people, you're going to have a positive impact long term.
Wonderful, because the three metrics that you did mention was employee satisfaction, patient satisfaction, and the third was financial improvement. And really, you're directly working for employee satisfaction. That's it. But everything else falls in place because the employees are satisfied because of the result. And that's, again, it's 2 layers down, but it's hard to measure, but the results are too obvious, I would imagine. All right. So this question is kind of a compound question. You have an impressive growth metrics, like 40% increase in qualified leads, 53% in pipeline growth. And you also have worked with the government institute in UK, for example, and this 40% and 53% increase in qualified leads is probably more into more open market like the United States, I would imagine, right? And what kind of challenges have you faced in different systems where you have one government payer system and then you have this disparate systems in the United States? Are the challenges different, or is there a more or less pushback in one or the other system?
Yeah, we're in an interesting position where, especially in the United Kingdom, we have been partnering with the healthcare system, with the National Health Service in England in particular, for so long now that we do have a reputation that helps. And again, when you're talking about selling culture change, you need to have kind of a lot of the stars align, if you will. You have to have an executive team that is bought in, that's identified that, we need to do something different and we need to bring in outside help to advise on how we might make that happen, and that they have the confidence that they can invest in something that's going to take a few years, which is not a luxury that many healthcare systems and many healthcare executives have these days. I think I read a metric that for the most challenged health systems in the world, their CEO turns over every 18 months. So if you think about it, if you're in a very troubled organization, lots of issues. You come in, you may not be there a year and a half from now if you don't turn it around quickly. And if the issues are systemic, it's going to be pretty hard to turn it around in 18 months. So out the gate, I feel like we have a fairly hard sell, and our sales cycle is really long at Virginia Mason Institute. So the key, regardless of whether it's in the US or the UK or in Australia or in the Middle East or in Denmark, where we have clients in all those locations, regardless of the location, it's about building relationships with those key decision makers. So in order to build your pipeline, in order to get an opportunity to work with more health systems, you need to be able to produce compelling content and have a relationship and have a reputation for providing quality service, and have the ability to invest in building those relationships, whether or not that health system is going to work with you or not, which meant oftentimes it's not, because they can't commit to that multi-year journey. But it's all about relationships, and it's about, again, creating that content and having the reputation so those relationships can succeed. As you mentioned also, or as you asked also, working with the National Health Service in England in particular there's added complexity because of government procurement processes. There's often a process where you may have a great relationship with a health system. They may be very interested in working with you, but you need to go through procurement, and you need to go through a tendering exercise, which can take a year in some cases, just to get to a status that you're preferred provider, and then you can negotiate a contract. And so it takes perseverance. Many people that, maybe listening to this who have experienced government procurement before, there's a whole lot of hoops to jump through, a lot of certifications, a lot of, being open to sharing every aspect of your business around your financials, and it's a very long and drawn out process. In the United States, there's the benefit of private health systems that have an executive team that want to move forward. They have the budget. They can just make a decision, and you can be up and running much, much more quickly. So I think there's that.
So positives and negatives, that with the United system, there's several systems that you have to deal with, but it might be quick. Sales cycle is much shorter. And I believe you have a passion for health tech. You are a futurist and a thought leader in this space. What do you see is the biggest opportunity for health tech to make a meaningful impact right now?
Yeah, I think so. For me, over the past couple of years, I've gained a much bigger interest in technology and in health tech in particular. As we've discussed, I've spent pretty much my entire career focused on process improvement, people, process, culture change, and seen amazing results and really great improvements. However, the healthcare system, especially post-pandemic, which the pandemic kind of exacerbated, and a lot of the issues that have been present and systemic in healthcare for many, many years. Healthcare systems are struggling everywhere. Labor shortages, there's aging populations, less and less people that are interested in working in healthcare. You have to have specialized labor. You can't just, hire someone off the street to be a doctor or a nurse. They need to have certifications, they need to have training. And the cost of not only labor, but the cost of pharmaceuticals, the cost of medical devices and equipment, facilities. Many health systems have been around for a really long time and have aging facilities, so their infrastructure is crumbling and they need massive capital investments, which they aren't generating enough revenue. And then you have craziness that's happening in the United States with government measures that are reducing, potentially reducing funding, reducing Medicare, Medicaid, that sort of thing. And so all these issues are just piling on. And so the way I've been thinking about it lately, and more, the past couple of years in particular, is that, you need to have the culture that's going to support improvement. I still believe in that. You need to invest in your people, but it may not be quick enough to address, all these things. And, it used to be that financial concerns were at the top of healthcare CEO's list of things they're concerned with. And I think the last couple of years, the different major consulting firms that do surveys and studies on this, it's switched to labor shortages as being the top concern. And so you need to be able to make your health systems more efficient. You need to, unfortunately, be able to do more with less people and higher quality at the same time. And so I think an obvious answer there is to integrate technology. And, advances in artificial intelligence and these sorts of things have proven or starting to prove that they can help, a single person provide higher quality service at a lower cost and perhaps even be, 5 times, 10 times more productive than they were before because they have a technology that's supporting them. A big thing, one of the big changes that's happened in the last, 20 years, 10 years, 15 years in healthcare in the tech space has been kind of all focused on electronic health records and getting your EHR. And that, as we all know, created more administrative burden where it started doing things like taking nurses and doctors away from the patient, away from the bedside, because they had to spend all this time clicking around in a system and documenting and trying to figure out how to comply with whatever they need to comply with. And I think we're getting better and better than that in that space. And I think that continued innovations in technology and improvements in that space are going to be necessary to realize the innovations that are necessary to actually see the improvements that we need to see and get healthcare into a better space globally.
That's a really key point, and I think based on my conversations, I think you hit the nail on the head. Essentially, if we can take away the burden of administrative work, the people who are trained for patient care can do more patient care than the administrative work. You have been a leader in the healthcare space, and not only have you been a leader, but you also train leaders in the healthcare space. So what would be the advice for the new leaders or the new entrepreneurs who are coming into health tech and healthcare space?
Yeah, I think be humble is a big thing. Healthcare is really complex and you can't assume that you know everything. And so be humble, be open to asking for guidance, asking for feedback, and focus on building your own skills and capability and those of your team and engaging your team as much as possible in anything that you're trying to do. It doesn't mean that at the end of the day that you should just be deferring all decisions and trying to create a pure democracy where everyone has to vote on everything. But really make sure that you understand the processes, make sure you understand where your team is coming from, their perspectives. And I think that's essential. I think it's essential for any leader, new leader, leader that's been around for a long time. Specifically for health tech startups, I think that one thing that I've learned over the past couple of years since I've been mentoring health tech startups with startup accelerator programs, is that they often underestimate the complexity of healthcare and underestimate their own knowledge, or overestimate rather, their own knowledge of clinical workflows. I think that one of the biggest issues is there may be some really interesting, innovative technology that they've developed, but if it doesn't integrate into the clinic workflow, it's going to be really, really hard to get clinicians and get health systems to want to adapt it. And so I'd say invest that time and energy in understanding the healthcare processes, understanding the perspectives of the clinicians. And I think there's a space to challenge clinicians' perspectives, but you also have to very quickly be able to show that you have something that is going to be useful to them, that's going to help them be more efficient, that's going to help them create a safer environment for their patients. And if you can't do that very quickly, it's going to be really hard for you to succeed as a startup.
All right. Your advice is try to integrate your system into the current clinical workflow so that the healthcare worker does not have to learn another system to solve their issues. Make sure that it is seamless for them to work through the workflow, the current existing workflow.
Yep, absolutely. And if you can, challenge that workflow and show them how you can make that workflow more efficient through the technology. But if they can't very quickly understand how it's going to fit in their workflow or how it's going to make their workflow better, you're going to struggle.
Okay. Education is paramount in this space. 100%.
Education, and you cannot discount change management. You can't discount really understanding the current state, understanding where people are coming from, how they feel about that change, or any past experiences they've had that haven't gone so well with implementing new technology. If you can understand that and you can demonstrate that you understand that, you're going to be in a much better position to actually get your technology adopted.
Okay, this was really good. Effectively learn the system, learn experience of your individual client, and that will be the baseline for you to develop your product and be successful eventually. right? Final question for you, Gordon. This is your 90 seconds and it could be 4 minutes if you want. Is that if there is any questions that I missed, any critical thing that I missed, or if you want to reiterate something that is really important, the question is an open question and it's for you to ask yourself and answer it.
Yeah, I think, as I had mentioned a little bit earlier, I've had a growing interest in the health tech space for the last little while. And I think one of the things that I'm really interested in exploring and interested in diving deeper into is this issue. I want to say it's Deloitte, perhaps it was McKinsey, actually, perhaps it was both, have come out with studies that show that about 70% of new health tech startups fail to get past pilot into adoption. So it's a pretty high failure rate. And I feel confident in some of the things that we've talked about, which is that the startups don't fully understand the complexities of the healthcare space. They aren't able to very quickly build relationships and demonstrate how their technology is going to improve in the clinical workflow space. It's essential that when a new health tech company is looking to get their technology into health systems, that they take the time to really understand clinical workflows, to really understand the perspective of the healthcare provider, and as much as possible to co-design with those healthcare users, especially frontline staff, especially the people that are going to be interacting with their technology day in, day out. I think that you can't undersell, from my experience, the amount of experience and the value you get from engaging in that co-design process and really understanding those perspectives. I think another key thing to focus on is the importance of building adaptability into whatever you're creating. And whether that's technology, new technology, or whether that's process improvement, there's something we talk about at Virginia Mason Institute quite a lot, which is that better never stops, that improvement never stops. I think another key point is that it's essential for us to understand operational systems, not just the pain points within those systems. So you may have a solution that is really good at solving a pain point, but if that solution doesn't integrate with the overall operational system, you're not going to be successful. So one thing I've learned over the past 15 years working in healthcare is you cannot discount the importance of people and process, and really understanding clinical workflows, understanding the experience of the patient and the clinicians, and the nuances of the communities that those health systems work within. And I think that health tech startups in particular are often challenged to really understand the complexities and the depth of all those things within the healthcare space. And I've been really excited most recently in the opportunities I've had to work with health tech startups in that space and helping them understand that. And I'm happy to connect on LinkedIn if anybody is interested in exploring healthcare industry, exploring health tech adoption, and exploring process improvement and culture change in the healthcare space. Thank you.
Wonderful. Thank you very much, Gordon, for your time today. It was an incredibly learning experience for me, and I'm sure my audience would love to hear all the golden nuggets that I have dropped here. So thank you again.
Appreciate it. Thank you so much.